Hi, I'm Rachel. I'm a therapist with JFCS, and we'd like to give you more information about OCD for October's OCD Awareness Month. So what is OCD? So it stands for Obsessive Compulsive Disorder. You may have heard people say things like, oh, I'm so OCD, or yeah, I definitely have OCD. But what does that actually mean? Maybe you've seen characters on TV like Monica from Friends, or you've seen other characters that you can sort of identify with, but a lot of the symptoms that are often highlighted are things like organization, cleanliness, and fear of contamination. That's not all that OCD is. So what even is OCD? So let's start with obsessions. To break it down, all obsessions are thoughts, images, or mental experiences that you have that cause you a lot of distress. So it's something that's going on in your head. Sometimes people have really vivid images. They get pictures of things that really bother them. Sometimes people get really, we call them intrusive thoughts that really bother them. And those obsessions tend to lead to really big emotional experiences, usually a lot of worry, fear, but sometimes frustration and anger. So what is a compulsion? A compulsion is something that we do to help us feel better. So a compulsion doesn't just have to be washing your hands, it doesn't just have to be, color coding things or organizing your spice rack. Those are very small symptoms on a very long list of things that people can do to help themselves feel better. Some really rare examples that might surprise people are things like blinking a lot to help yourself feel better, or maybe you actually do something like knocking on wood, or clapping your hands, or rubbing your ear to help yourself feel better. There's really no exhaustive list of what someone can do to help themselves feel better, but we do have categories that we use to help guide us to better understand, what is it that someone is doing that can fall under a compulsion. So if you find yourself experiencing a lot of what if thoughts, thoughts that tend to pop into your head along with images, maybe images of you hurting yourself or hurting someone else, or maybe you're having images of getting sick or whatever it could be that's leading you to feel really upset, really overwhelmed, and then doing something to help yourself feel better. Just a couple of examples. That would be when you want to follow up with a healthcare provider to see, maybe I do have OCD. Maybe I can get a little bit more information or get a professional to do an assessment with me. So a great place to start would be contacting your primary care physician or reaching out for therapy. I'm an OCD specialist, and so for example, I could do an assessment with you to better diagnose an OCD diagnosis. So if you would like to seek out therapy here at JFCS, you are welcome to contact our main line. If you're concerned about a child or adolescent in your life that you are suspecting has a mental health disorder or OCD, you can also refer them to our Upstreet program, which serves folks from age 12 to 22.